Each vial contains 75 international units or IUs of Menopur. Always take Menopur exactly as directed by your healthcare provider. If you have any questions about your treatment or medication, you should contact your healthcare provider. In this video, an optional vial adapter will be used for the reconstitution of the medication. Alternatively, to reconstitute without a vial adapter, follow the patient instructions, which can be found packaged with your Menopur. Before you start, make sure that you have gathered all the items you will need and that you have prepared a clean surface, such as a table or worktop. You will need 1 or more Menopur vials, depending on your prescribed dose. 1 vial of sodium chloride, also known as your sterile diluent, a sterile syringe, a subcutaneous injection needle, a vial adapter, some alcohol swabs, some cotton ball or sterile gauze, and a needle disposal container. Wash your hands with soap and water and dry them with a clean towel. Check that you have the right number of Menopur vials that correspond to your prescribed dose. Each vial contains 75 IUs of Menopur. Then check that the Menopur vials contain a powder and check its expiration date. Similarly, check that the liquid in the diluent vial is clear and does not contain any particles and check its expiration date. If the powder is missing or if the liquid is not perfectly clear, contact your healthcare provider. Do not use the vial. Now, open the blister pouch containing the vial adapter by peeling back the label and set it aside for later use. Be sure to leave the vial adapter in the pouch at this time and not to touch the ends of it. It is very important not to contaminate the vial adapter. Next, remove the plastic caps off all the vials. Wipe the tops of the vials with an alcohol wipe and allow them to dry. You are now ready to reconstitute your Menopur. Hold the diluent vial firmly flat on the table. With the vial adapter still inside its blister pack, place it on top of the vial. Push the vial adapter straight down into the rubber stopper of the vial until the spike pierces it and snaps into place. Remove the blister pack. Do not use the vial adapter if it falls out of the blister pack before it is connected to the vial. If that happens, discard it and use a new one. After it is connected to the vial, do not touch the connector end to avoid any contamination. Now take the syringe and pull the plunger rod until you reach the line that corresponds to the amount of diluent you need. This should be provided by your healthcare provider, and it is typically 1 milliliter. Once it is set, be very careful not to move the plunger rod during the next step. Place the tip of the syringe into the connector end of the vial adapter and screw the syringe clockwise until it is tight. Be careful not to over-tighten the syringe. Slowly push the syringe plunger all the way down to push the air from the syringe into the vial. While holding the plunger down in the syringe, turn the syringe and vial upside down with the vial on top. Then slowly pull the plunger rod to draw the required amount of diluent from the vial into the syringe. You now need to remove the vial adapter from the vial. To do this, while holding the vial securely, with a bit of force, pull on the vial adapter to detach it from the vial. The adapter should remain attached to the syringe. You are now ready to mix the first vial of Menopur. Hold the Menopur vial firmly down on the table and place the tip of the vial adapter on top of the vial. Carefully, without pushing down on the plunger, push the vial adapter straight down into the rubber stopper of the vial until the spike pierces it and snaps into place. Slowly push down on the syringe plunger to push the diluent into the Menopur vial. Then gently swirl the vial until the Menopur powder is completely dissolved into the diluent. The Menopur powder will dissolve quickly. Do not shake the vial, as this will create bubbles. Check that the liquid is clear. If the liquid is discolored, do not use this vial and contact your healthcare provider. After making sure that the Menopur powder is completely dissolved, while holding the plunger down in the syringe, once again turn the syringe and vial upside down and slowly pull the plunger to draw all the Menopur solution into the syringe. Keep in mind that a small drop of liquid will always remain in the vial. This is normal. If you are prescribed more than one Menopur vial, mix your first Menopur vial of powder with diluent. Do not inject your dose yet. Instead, following the steps described earlier, use the liquid in the syringe you have just mixed to dissolve the next Menopur vial. A maximum of 6 Menopur vials can be reconstituted using 1 milliliter of diluent. Once you have finished reconstituting all the Menopur vials needed for your prescribed dose and have drawn up the medication into the syringe, you are ready to prepare the syringe for the injection. While holding onto the vial adapter, carefully unscrew the syringe counterclockwise to remove it. Then carefully set the syringe with the medication down on the table, and be careful not to contaminate the tip of the syringe. Remove the needle from its packaging, but keep the needle cap on. While holding the syringe, place the needle onto the syringe and screw on the needle in a clockwise direction until it is tight. Now remove the cap by pulling it straight off. To remove air bubbles from the syringe, hold the syringe with the needle pointing up. Now pull down slightly on the plunger and tap the barrel of the syringe to make any air bubbles rise to the top. Slowly push the plunger up until a small drop of liquid appears at the tip of the needle. Tap the syringe to remove the drop of liquid and set the syringe down on the table. Be careful not to let the needle touch anything to keep it sterile. You are now ready to give your injection. Menopur is intended to be given by injection just under the skin, subcutaneously in the abdomen, as instructed by your healthcare provider. It is important to alternate the exact site of injection from day to day to lower the risk of skin reactions. Clean the injection site by wiping a small area of your abdomen with an alcohol swab and let the area air dry. Do not touch this area again before you give your injection. To inject, gently pinch the skin around the disinfected area between your thumb and index finger and insert the needle all the way in, straight into the pinched up skin. Then, with a steady motion, push the plunger with your thumb all the way down and gently pull the needle straight out. If blood appears at the injection site, press a cotton ball lightly on the site. Safely dispose of all your used needle, syringe, and injection materials according to your local waste regulations. Please inquire with your healthcare provider. You will not need the remaining diluent. Needles must never be disposed of in household waste. That's it! You may wish to repeat this video during the course of your treatment. Please remember to keep your instructions, and should you have any further questions related to the Menopur or how to inject your medication, please contact your healthcare provider.